So the next adjustment is going to be an anterior medial talus, which we have done our motion and figured out that our listing is anterior medial. It doesn't drop away on this side on dorsiflexion. So the contact point for this is going to be the anterior medial aspect of the talar dome. The important thing with this one, which makes it different to your anterior lateral, is the contact hand that you use. So you want to make sure that you always, for an anterior medial, is that you use your lateral or your outside hand, because we want some of our line of drive to be M to L, and this it's like the posterior medial fibula, having this as our contact hand is going to allow us to pull in that direction. So outside hand is important for this move. Otherwise you get the wrong line of drive. So your doctor's contact point, again, is going to be the finger pads of your third and fourth fingers. And for this one, you are actually going to take a tissue pull. We don't often take a tissue pull with these extremity moves, but this one we do. So you're going to kind of slide down onto the talus. Remember, the talus is in between your medial and lateral malleoli. So it's going to be right in the center there. So you're going to slide down onto the anterior medial aspect of the talar dome. So you've kind of slid down in an S to I direction. Then you're going to push the foot up into dorsiflexion. So when we do this adjustment, we want the foot as dorsiflexed as we can get it. You're going to stabilize with your opposite hand, same fingers on top of your contact point, and then that both thumbs on the underside of the foot is what allows you to push the foot into dorsiflexion. So this one is definitely one that you'd get the person to hold onto the table, because you are going to distract S to I, and then you are going to pull in an S to I direction really quickly. And you don't want to, especially if they're small and you're really strong, you don't want to pull them off the table. So slide down, anterior medial aspect of the talar dome, push the foot into dorsiflexion, stabilize on top. For this, I usually have to stand and do both feet upright. And again, you're going to distract S to I. The person's almost going to feel like their ankle gaps a little bit, and then you're going to pull in an S to I direction, slightly M to L. To do an anterior lateral move, you're going to do the same thing, but now you're going to be on the anterior lateral aspect of the talar dome. So this one is going to be the opposite. It's important that you use your medial hand as your contact hand, not your lateral hand, because we want some L to M in our thrust. And because this is our contact hand, we're going to get more L to M if we use this hand than if we use this hand. So same thing, tissue pull down onto the talar dome, lift the foot up into dorsiflexion, stabilize on top with the other fingers, push the foot into as much dorsiflexion as you can, get yourself into a position, pull the foot S to I, and then you're going to thrust in an S to I direction, pulling the person down the table, and the L to M will come naturally because of the contact hand that you've used and the fact that you'll pull slightly towards yourself, which will be the L to M component. This move can also be transferred down to the rest of your tarsals when they move superiorly. So if you've got a superior navicular, remember we find the navicular by finding the medial malleolus, going distal, maybe an inch, 2 inches, depending on the size of the person, to find the navicular tubercle, pop on top of the foot, staying in line with that tubercle to know that you're on the navicular, and this is going to be the same move. However, our listing for a navicular is going to be either superior or inferior. So if we've got a superior navicular, we don't need to worry about the medial or the lateral aspect of the listing or the line of drive, because it's just moved straight superior. So you can use either hand as your contact hand for a superior navicular. So make sure you find the navicular appropriately. You know that it's superior from the motion that you've done. Let's just I'm going to use my medial hand as my contact hand, same finger pads on the top of the navicular, stabilization, put the foot into dorsiflexion, traction the leg S to I, and then you're just going to try and apply an S to I pull just on the navicular. No M to L, no L to M. You can move that down even further and do that for a cuneiform as well. The other thing you can do, you can obviously use the X drop. You could put the ankle on the X drop, and then just that'll include a drop in your adjustment. That's fine as well. You could also use an activator and just go straight S to I down on the navicular or the cuneiforms. But yeah, really easily transferable just down the rest of the tarsals. Cuboid is a little bit different, so we will do that separately. So for the cuboid, I'm just going to show you the way which you'd be able to figure out yourself if you use the activator. A way to adjust a superior cuboid. I think the way in your notes is quite hard. A way to do it manually, it kind of almost involves like a toggle onto the cuboid. But I think that for this bone, I specifically would use the activator. I find that it has a really easy, it's really easy to get the line of drive with an activator. And because you've got, when the cuboid goes superiorly, it almost kind of also goes a little bit lateral. So it's nice that you can kind of get your activator in there and adjust in a S to I, L to M type direction with the activator. Because this isn't a manual move, you can look at the one in your books, totally have a look at it, use it in practice if you want. However, I won't assess you on this one because I think this is a more effective way of adjusting it myself. And because in the final practical we want you to show us the manual moves, I won't do a superior cuboid. So yeah, I would use the activator for this one. Remember what I said about extremities. Basically, you can kind of make up a move, and as long as it's safe and you are adjusting in the right direction, you're pretty much fine. But preferred for me, I would use the activator for this one.